The head nurse's hand froze on the phone. On the other end, a voice she'd never expected to hear in her 18 years at Metropolitan ICU, the Pentagon switchboard. "We're patching through General Marcus Holt. He's requesting to speak with one of your staff members." She almost laughed, because there were only 3 people on the night shift, and she knew damn well none of them had connections to a 4-star general. "I think you have the wrong hospital. Michael Chen, former Army medic, currently employed in your facility." The name hit her like ice water. Michael Chen, the janitor who'd been mopping their floors for 6 months, the quiet man they barely acknowledged, the one who cleaned up after their mistakes without a word. Her eyes went to the supply closet where she'd sent him 20 minutes ago. Yes, sent him like he was nothing, like he was invisible. "I need to speak with him immediately," the general's voice cut through. "It's regarding my son." The nurse's throat went dry, because the general's son was in room 408, critical condition, 48 hours post-op. And she'd just kicked the janitor out of that hallway for the 3rd time tonight. Nobody at Metropolitan ICU knew Michael Chen's real story. They saw the blue custodial uniform, the cleaning cart, the quiet Asian man who showed up at 11 p.m. and left at 7 a.m. without causing problems. They didn't see the scars hidden under his sleeves. They didn't know about the 18 months in Kandahar province, where he'd kept 23 soldiers alive with nothing but field supplies and steady hands. They didn't know he'd been offered medical school, a direct commission, at a dozen paths that would have put letters after his name. They just saw the janitor. Dr. Patricia Morrison saw him first on his 2nd day. She was the ICU director, sharp, brilliant, and absolutely certain about the hierarchy of her unit. She'd built this ICU from the ground up over 12 years. Every protocol, every standard, every line of authority ran through her. "You're the new night custodian?" She didn't wait for his answer. "Listen carefully. You don't touch medical equipment. You don't enter patient rooms during active care. You don't speak to families unless they ask you a direct question. Are we clear?" Michael had nodded. Just nodded, because he'd learned something in the army that most people never understand. Sometimes you learn more by staying quiet than by proving yourself right. Rachel Kim, the head night nurse, was different. Not better, just different. She was efficient, professional, and absolutely convinced that everything outside direct patient care was beneath her attention. Housekeeping, maintenance, dietary, all of it was just background noise to the real work of medicine. She glanced at his name tag that first week. "Chen, you speak English?" He'd grown up in Sacramento. His parents owned a restaurant. He'd graduated top of his class from UC Davis, but he'd just nodded again. "Good, there's blood in room 403. Clean it up before day shift." Michael had cleaned it up. He'd cleaned up everything they'd needed for 6 months. Coffee spills in the break room, biological waste they'd missed, the chaos that 19-hour shifts created when brilliant people stopped seeing the details. He'd watched Dr. Morrison make rounds with absolute authority. Watched Rachel manage her nurses with military precision, watched them save lives with skill that reminded him why he'd loved medicine in the first place. He'd also watched them miss things, small things, the kind of small things that killed people in combat zones when everyone was too tired or too certain to look twice. But he was the janitor, so he'd stayed quiet. Until tonight. Until a 23-year-old Army Ranger named David Holt came through those doors with complications from a routine surgery that weren't routine at all. Until everything Michael had been trying to leave behind came walking right back into his life. David Holt hit the ICU at 11:47 p.m. on a Tuesday. Post-operative complication from what should have been straightforward appendix surgery at the base hospital. But something had gone wrong. Infection markers climbing, blood pressure dropping, and nobody could figure out why. They'd transferred him to Metropolitan because it was civilian, because it was close, because the military hospital was packed with casualties from a training accident that same day. Dr. Morrison took one look at the chart and frowned. Sepsis protocol, get me cultures, broad-spectrum antibiotics, and I want hourly vitals. Rachel was already moving, her team falling into practiced rhythm. IVs placed, monitors connected, medications flowing. Michael was emptying trash bins in the hallway when the gurney rolled past. He saw the patient's face, young, pale, struggling against restraints in delirious fever. Saw the military haircut, the dog tags they hadn't removed. Something in his chest tightened. A muscle memory from a dozen field hospitals, 100 nights triaging the wounded. He kept moving, not his place, not his job. He was mopping outside room 408 an hour later when he heard Dr. Morrison's frustrated voice. Cultures will take 48 hours. We can't wait that long. His pressure's still dropping. Already maxed on pressors, Rachel replied. What else do you want me to do? Through the open door, Michael saw the monitors, saw the numbers that told a story these civilian doctors were missing. He saw it because he'd seen it before. In a field hospital outside Kabul, in a 19-year-old kid from Nebraska who'd presented exactly the same way. Compartment syndrome, secondary to the surgery, pressure building in the muscle tissue, cutting off blood flow. Missed because everyone was focused on infection. He gripped the mop handle, stayed silent. Not your place, he told himself. You're not that person anymore. But 10 minutes later, when the patient's pressure dropped again, and Dr. Morrison ordered another liter of fluid, exactly the wrong call for compartment syndrome, Michael's hands started shaking. Because he knew what happened next. He'd seen it. The fluid would make it worse. Pressure would build. Tissue would die. They'd figure it out eventually, maybe, but by then this kid would lose the leg. Or worse. Michael left his mop in the hallway and walked to the supply closet. Not to hide, to think, to decide if 6 months of invisibility was worth a kid's life. Michael came back with his cleaning cart. But instead of mopping, he slowed as he passed room 408. The door was partially open. Dr. Morrison was at the nurse's station, or buried in charts. Rachel was dealing with another patient 2 doors down. The monitors showed David Holt's pressure still dropping despite the fluids, his heart rate climbing, classic signs they were missing. Michael stopped. Every instinct screaming at him to walk away, he went in instead. David was barely conscious, thrashing weakly against the restraints. Fever had him confused, disoriented. Michael moved to the side of the bed, keeping his movements calm, professional. He pulled back the sheet covering David's left leg. The calf was swollen, tight, skin stretched and discolored in a way that confirmed every suspicion. Hey. David's eyes flickered open, unfocused. Who are you? Just checking on you, Michael said quietly. His fingers found the pulse points, weak, diminished, exactly what he'd expected. He glanced at the door, eyes still clear. His hands moved on autopilot, checking compartments, measuring circumference differences between legs with nothing but visual assessment. Every technique they'd taught him when supplies were limited and lives depended on quick thinking. You're military, David mumbled. I can tell. Was, Michael corrected softly. Medic? Michael hesitated, then nodded. Thought so. You got different hands, different way of... David's words trailed off as another wave of pain hit. Listen to me. Michael leaned closer. Your leg has compartment syndrome. Do you know what that means? David's eyes focused slightly. Pressure building? Need fasciotomy? Exactly. But your doctors think it's just infection. They're treating you wrong. Tell them. I'm the janitor. They won't listen. David managed something between a laugh and a cough.
So what are you doing here? Good question. What was he doing here, risking everything he'd built? This quiet, invisible life where nobody asked about the nightmares or why his hands sometimes shook when he saw certain injuries. Making sure you don't lose that leg, Michael said finally. He heard footsteps in the hallway. Rachel's voice giving instructions to another nurse. Michael was out of the room in seconds, back to his cart, head down, as Rachel passed without a glance. But he'd made his decision. He couldn't save David directly, not without credentials, without authority, without breaking every rule in the book. But he could make them see it, make them understand before it was too late. The question was how. Michael waited 30 minutes, watched Rachel complete her rounds and return to the nurse's station. Watched Dr.
Morrison finish her paperwork and grab coffee from the break room. He approached with his trash bin. The universal pass to be anywhere, see anything, while remaining invisible. Excuse me? His voice was quiet, respectful. Rachel didn't look up from her computer. Trash cans are fine. Don't need you right now. It's about the patient in 408. That got her attention. Her eyes lifted, sharp with irritation. You were in a patient room? I was cleaning the hallway. I noticed... You noticed nothing? You're not medical staff. Whatever you think you saw, you're wrong. Michael kept his voice steady. His left calf is swollen. The circumference is at least 3 centimeters larger than the right. His distal pulses are weak. These are classic signs of... Stop. Rachel stood up. I don't know what you think you're doing.
Aye, but you need to understand something. You push a mop, that's it. You don't diagnose or you don't observe patients. You especially don't question medical decisions. I was an army medic. I don't care if you were the Surgeon General. In this hospital, you're housekeeping. Now get back to work before I call security. Michael felt the familiar weight settle in his chest. The same weight he'd felt every time some lieutenant fresh out of West Point had ignored his field assessment because Michael didn't have the bars on his collar. He nodded, backed away. But he walked straight to Dr. Morrison's office. She was reviewing scans when he knocked, looked up with barely concealed annoyance. Dr. Morrison, I need 60 seconds. For what? To tell me about a cleaning supply order? To tell you that David Holt in room 408 has compartment syndrome.
Not sepsis, and if you don't get a surgeon to do a fasciotomy in the next few hours, he's going to lose his leg. The silence stretched out. Dr. Morrison's expression shifted from annoyed to something harder. Get out! Doctor, please, get out of my office. Better yet, get out of my ICU. I'll be calling your supervisor in the morning to discuss your complete lack of professional boundaries. Do you understand how dangerous it is for non-medical personnel to... More dangerous than missing a diagnosis? Dr. Morrison's face went cold. Leave, now, before I make this an official incident. Michael left, but he wasn't done, not even close. Michael went back to his cart, went through the motions of cleaning while his mind raced through options. He could call the military hospital directly, tell them what he was seeing, but without proof, without credentials here, why would they believe him over their civilian partners? He could document everything, take photos, but that was a HIPAA violation that would get him fired and possibly arrested. He could wait. Hope that Dr. Morrison or Rachel would notice the signs before it was too late. But he'd tried waiting in Kandahar once. Tried trusting that the doctors at the field hospital would figure it out. The kid had died before they'd realized Michael had been right. At 2 a.m., David Holt's monitors started alarming. Michael was in the break room, but he heard Rachel's sharp commands, the rush of footsteps. He moved to the hallway, in time to see Dr. Morrison running toward room 408. David was crashing, blood pressure through the floor, heart rate erratic. Through the chaos, Michael heard Dr. Morrison's orders. Push another liter.
Increase the pressors. Get me an echo to check heart function. Every single intervention making the compartment syndrome worse. Michael's fists clenched. He couldn't just stand here. He moved closer to the room, staying in the doorway where he could see but not interfere. David was semi-conscious, pale as death. His left leg was visibly larger now, the swelling obvious even to untrained eyes. But they were all focused on the monitors, on the numbers, on the protocols they'd been taught. Nobody was looking at the patient. His leg, Michael said from the doorway. Get him out of here! Dr. Morrison didn't even turn around. Look at his leg. Rachel spun on him. Security! We need security in ICU. But Dr. Morrison had glanced down. For just a second, her eyes had followed Michael's voice to David's left calf. She saw it.
Michael watched the realization hit her face, the moment of recognition. Rachel, hand me a tape measure. What? Doctor, we need to focus. Now, tape measure. Measure both calves. Rachel moved, confused but obedient. Measured. Her face went pale. 7-centimeter difference. Check the distal pulse. Rachel's fingers found the point. Pressed. Her professional mask cracked. Barely palpable. Dr. Morrison's jaw tightened. Get me a surgeon. Tell them we need an emergency fasciotomy now. She looked at Michael then. Really looked at him for the first time in 6 months. Who are you? Security arrived before he could answer. 2 security guards, both guys Michael recognized from his nightly rounds. Usually they just nodded at each other, fellow night shift workers navigating the fluorescent world while everyone else slept. Tonight, they looked uncomfortable. Sir, we need you to come with us, the older guard said. Professional, respectful, but firm. He just saved that patient's life, someone said. Michael turned. One of the younger nurses, Amy, he thought her name was, stood near the nurses' station. She'd been watching the whole thing. He's not medical staff, Rachel said sharply. He violated patient privacy, disrupted care, and he was right. Amy's voice was quiet, but clear. We all saw it. That patient has compartment syndrome. We missed it. He didn't. That's not the point. Dr. Morrison had regained her composure, her authority. Hospital policy exists for a reason. Patient safety requires clear lines of responsibility. I don't care if he was right. He had no business. Would you rather the kid lost his leg? Amy asked. And the question hung in the air. Dr. Morrison's expression hardened. My ICU runs on protocols, not vigilante heroics. If we let every custodian or cafeteria worker start diagnosing patients, people will die. This is non-negotiable. She turned to the security guards. Remove him from the floor. I want him in the administrative office until we can process his termination paperwork. Termination? Amy looked shocked. For saving a patient? For violating hospital policy and patient privacy? For insubordination when asked to leave a patient area? For creating a dangerous precedent that undermines the entire medical hierarchy that keeps this hospital safe? Michael didn't fight as the guards moved toward him. What was the point? He'd known this was coming the moment he'd opened his mouth. Wait! Rachel's voice. Michael looked at her, surprised. She was staring at her computer screen, her face drained of color. What is it? Dr. Morrison asked. I just got an email from the Pentagon. Rachel's voice was strange, hollow. They're asking for our contact information for Michael Chen, former Army medic, They say a General Marcus Holt has been trying to reach him. The name hit the room like a bomb. David Holt, son of General Marcus Holt. Dr. Morrison's face went white. General Holt, as in 4-star General Marcus Holt. Commander of the entire Pacific Theater, Rachel whispered. His son is in room 408. Everyone turned to look at Michael. He stood there in his blue custodial uniform, silent. You knew, Dr. Morrison said slowly. You knew who he was. I knew he was a 23-year-old ranger who needed help, Michael said quietly. That's all that mattered. The security guards had stopped moving. Nobody seemed sure what to do. The general is calling the hospital administrator's office, Rachel read from her screen. He was notified his son is in critical condition. He's requesting immediate update from... She paused. From Michael Chen, former combat medic under his command in Afghanistan. The ICU had gone completely silent. Dr. Morrison stared at Michael like she'd never seen him before. You served under General Holt? 3rd Infantry Division, Kandahar Province, 2019 to 2021. Why didn't you say something? Why didn't you tell us you had medical training? Michael met her eyes. I did. Tonight. You told me to get out. The truth of it hung there, undeniable. Rachel's phone rang. She answered, listened, her face going through about 6 different expressions. That was administration. The general is being patched through to this floor. He wants to speak with Michael Chen immediately. Put him through to my office, Dr. Morrison said. No. Rachel's voice was firm. He asked specifically to speak with Chen, nobody else. All eyes turned to Michael again. The older security guard cleared his throat. Still want us to escort him out? Dr. Morrison opened her mouth, closed it. For the first time in the 6 months Michael had worked there, she looked completely uncertain about what to do next. No, she said finally. Take him to the conference room. Get him a phone with a secure line. She looked at Michael. After you talk to the general, we're going to have a very long conversation about who you really are. The conference room was cold, fluorescent lights humming overhead. A phone on the table, red light blinking indicating a call on hold. Michael sat down, stared at the phone. He hadn't spoken to General Holt in 3 years. Not since the day he'd left the army. Not since the night that had ended his military career. The door opened. Dr. Morrison and Rachel slipped in, taking seats against the wall. This is a private call, Michael said. This is my ICU, Dr. Morrison countered. And that patient is my responsibility. I'm staying. Michael didn't argue. He picked up the phone. This is Michael Chen. Chen. The voice was exactly as he remembered. Gravel over steel. A voice that had commanded thousands of soldiers across 3 combat zones. They tell me you're working as a janitor? Yes, sir. They tell me my son is in your ICU? Yes.
What, sir? They tell me you saved his life tonight. Michael glanced at Dr. Morrison. Her face was unreadable. The doctor saved his life, sir. I just noticed something they missed. Don't give me that humble bullshit, Chen. I've read the report. Compartment syndrome. You called it before they did. How bad was he? Bad, sir. Another hour, maybe 2, he would have lost the leg, maybe worse. Silence on the line. When General Holt spoke again, his voice was rougher. You always did see things others missed. Best medic I ever had. Saved more lives in 18 months than some doctors save in their whole careers. Dr. Morrison's eyebrows rose. Rachel leaned forward. Sir, I don't... Save it! I know why you left. I know what happened in Kabul. I know you blame yourself for things that weren't your fault. 23 soldiers, sir.
I had 23 soldiers under my care that night. I lost 4 of them. You saved 19 in a field hospital with no power, no supplies, during the worst attack we took all year. 19 kids came home to their families. because you refused to quit. 4 didn't. 4 died because a mortar hit the medical tent, Chen, not because you failed them. I told you that at the inquiry. I told you that at your discharge hearing. When are you going to believe it? Michael's hand tightened on the phone, the familiar weight pressing down on his chest. I recommended you for the Silver Star, General Holt continued. Did you know that? Command turned it down because you were already on your way out. Said it didn't fit the narrative. I didn't need a medal, sir. No. Well, you needed someone to tell you that you're one of the best damn medics the Army ever had, that losing soldiers in combat doesn't make you a failure, it makes you human. Dr. Morrison was watching Michael with a completely different expression now, something like understanding starting to dawn. I need you to do something for me, Chen. Anything, sir. I need you to take care of David, not as a janitor, as a medic. The doctors there are good, I've checked their credentials. But you're better, you see things they don't. My son is alive right now because of that. Sir, I'm not credentialed here. I'm calling the hospital administrator after this. I'm making it very clear that you have my complete confidence and authorization to be involved in my son's care. I'm asking you as his father and as your former commanding officer to make sure he makes it through this. Michael looked at Dr. Morrison. She was staring at him like he was a completely different person. I'll do everything I can, sir. I know you will. That's why I'm not worried. The line went quiet for a moment. Chen? Yes, sir? Thank you for being there, for seeing him, for giving a damn when you could have just walked away. Never could walk away, sir, you know that. A sound that might have been a laugh. No, I suppose you couldn't. That's what made you so good at this, and so terrible at leaving it behind. The call ended. Michael set the phone down carefully, looked up at the 2 women staring at him. Well, Dr. Morrison said quietly, I think we need to have that conversation now. Dr. Morrison folded her hands on the conference table. Her earlier certainty had cracked, replaced by something more complicated. How long were you in the military? 6 years, 4 years as a corpsman with the Navy, assigned to Marine units, then 2 years Army, after I cross-trained, as a combat medic. And your rank? Sergeant, E5. Education? Associates in emergency medicine from the Navy. Completed most of a bachelor's in nursing before. Michael trailed off. Before I left, Rachel pulled out her phone, typing quickly. Her eyes widened as she read. There are 3 military medical journals with your name on them. Research on field trauma care. One of them was cited by the WHO in their combat casualty guidelines. That was team research, Michael said quietly. A lot of people contributed, but you were the lead author on 2 of them. Rachel looked up. You developed a modified tourniquet protocol that reduced amputation rates by 18% in field conditions. Dr. Morrison leaned back in her chair. Why? Why the hell are you mopping floors when you could be? Because I can't be in an ICU anymore. The words came out harder than Michael intended. I can't be responsible for lives when I know I'll fail some of them. 4 soldiers, Dr. Morrison said softly. The general mentioned 4 soldiers. Michael's jaw tightened. We took mortar fire, direct hit on the medical tent. I had 23 wounded, no power, no backup. The generators were gone, half my supplies were destroyed. He could still see it, smell it, the copper tang of blood mixing with burning canvas and diesel fuel. I triaged them, did everything by the book, focused on the ones I could save. But there were 4, 2 with traumatic amputations, 1 with massive internal bleeding, 1 with a head injury. There wasn't enough of me to... His voice caught. They died while I was saving the others, died while I was 10 feet away, keeping pressure on someone else's wound. I heard them calling for me, heard them stop calling. The room was silent. The inquiry cleared you, Rachel said gently. The inquiry said I did everything right, said there was no way to save everyone, said I made the correct triage decisions. Michael met her eyes. That doesn't mean they're not dead. Dr. Morrison exhaled slowly. So you walked away from everything? I tried. Thought I could just work with my hands, do something simple.
Oh, it's something where I didn't have to decide who lives and who dies. But you can't walk away from what you are, Dr. Morrison said. No. Michael's voice was rough. Apparently I can't. That patient tonight, David Holt. You knew the risks. You knew we'd dismiss you, maybe fire you. But you spoke up anyway. He's 23 years old, his whole life ahead of him. I couldn't just let him die because you were afraid of failing again. The truth of it sat there between them. I've been doing this for 18 years, Dr. Morrison said slowly. Running this ICU, and I'm good at it. Really good. But I've gotten comfortable. Comfortable with my protocols, my hierarchies, my certainty that I'm always right. She looked at Michael. I almost killed that kid tonight because I was too arrogant to listen to a janitor.
Because I've built this entire structure around credentials and authority, and I forgot that medicine isn't about hierarchy. It's about seeing what's in front of you. You would have figured it out eventually, Michael said. Would I? Before he lost the leg? Before he died? Michael didn't answer. You're not a janitor, Dr. Morrison said firmly. I don't know what you are right now, but you're not that. And I'm not going to let someone with your skills and experience waste them because you're carrying guilt over something that wasn't your fault. What are you suggesting? I'm suggesting that we find a way to get you credentialed properly, get you back in medicine where you belong. I can't. You already did. Tonight. You jumped right back in the moment it mattered. You can't unring that bell, Chen. Michael looked down at his hands, at the same hands that had saved 19 soldiers, that had tried desperately to save 4 more. I don't know if I can do this again. Then let's find out, Dr. Morrison said. Together. But first, we need to make sure that General's son survives the next 24 hours. At 4 a.m., David Holt came out of emergency surgery. Dr. Sarah Brennan, the vascular surgeon, looked exhausted but satisfied. Got there just in time. Another hour and we'd be looking at amputation or worse. Whoever caught this saved his life. She looked at Dr. Morrison. Your team did good work. It wasn't my team. Dr. Morrison gestured to Michael, still in his custodial uniform. It was him. Dr. Brennan's eyes narrowed. The janitor? Former combat medic, apparently a very good one. Dr. Brennan studied Michael. Well, I guess we all learned something new. She turned back to Dr. Morrison. He's stable for now, but we need to watch for infection. Monitor the reperfusion carefully. The next 48 hours are critical. Understood. After Dr. Brennan left, Dr. Morrison turned to Michael. I want you on this case. I'm not credentialed. I'm credentialed. You'll work under my direct supervision. You'll observe. You'll advise. But I make all final decisions. That gives us legal cover and gives David the benefit of your experience. The administration will do what I tell them once I explain that a 4-star general specifically requested your involvement in his son's care. Dr. Morrison's smile was tight. Sometimes hierarchy works in our favor. Rachel appeared in the hallway. David's awake, asking for his father. General Holt is on a flight from D.C. Won't be here until tomorrow afternoon, Dr. Morrison said. Let David know, and... She glanced at Michael. Let him know that Chen is going to be part of his care team. Michael followed them to room 408. David looked better than he had hours ago, though still pale and hooked to more machines than anyone would want. His eyes found Michael immediately. "You." His voice was rough from intubation. "You're the janitor who told me I was dying." "Not dying, just needed surgery. They tell me you used to work for my dad. Worked under him. Nobody works for General Holt. You just try to keep up." David's laugh turned into a cough. "Yes, that sounds like him. He'll be here tomorrow, flying in personally. Great. He's going to kill me for getting sick on a routine surgery." But there was affection in David's voice. Pride. "He's going to be grateful you're alive," Michael said quietly. David's eyes sharpened. "The doctors said if they'd waited much longer, that I would have lost the leg, that you're the one who pushed them to figure it out. They would have found it. But you found it first, while mopping floors." David studied him. "Why are you mopping floors? Dad said you were the best medic in the division." Michael didn't answer. Understanding crossed David's face. "Kabul, the attack. I heard about it. Dad talked about it sometimes when he thought I wasn't listening. Said he lost a good medic that night, not to the mortars, to guilt. Your father talks too much. He cares about his people."
Even the ones who left." David's expression turned serious. "You saved my life tonight. Saved my career. I'm Ranger qualified. I can't be a Ranger without legs." "You would have found another way to serve." "Maybe, but I'm glad I don't have to." David's hand reached out. "Thank you for not walking away, for seeing me when everyone else just saw patient number." Michael took his hand, felt the strength still there, the future still possible. That's what medics do. We see people, even when we're trying desperately to stop. Morning brought new challenges. David's post-op numbers looked good initially, but by 8 a.m. his fever was climbing, white blood cell count rising despite the prophylactic antibiotics. Dr. Morrison studied the labs with concern. "We're not out of the woods."
Looks like infection despite the surgery." Michael was reading the overnight notes when something caught his attention. "What antibiotics did surgery use?" Rachel checked the chart. "Standard protocol, cephalosporin with aminoglycoside coverage." David's chart from the military hospital. Does it mention any allergies or previous reactions? No documented allergies. But Michael was remembering something. A conversation with General Holt 3 years ago about David's childhood. A bad reaction to something during basic training. "Call the base hospital," Michael said. "Ask specifically about any adverse reactions during basic training. Anything involving antibiotics." "We already have his complete medical history," Dr. Morrison said. "Military medical records are notorious for missing things that happened before enlistment. Trust me on this." Dr. Morrison hesitated, then nodded to Rachel. 20 minutes later, Rachel came back looking troubled. Penicillin reaction at age 16 caused severe allergic response, but was documented under his civilian pediatrician, not military records. And cephalosporins can cross-react. "We need to change his antibiotics now," Michael said. "The fever isn't infection from the surgery, it's a reaction to the medication." Dr. Morrison was already moving. "Get me pharmacy. I want alternatives that won't cross-react." By noon, David's fever had broken. The new antibiotic protocol was working. Dr. Brennan stopped by during afternoon rounds, looking at the revised medication list. "How'd you catch the cross-reaction? This isn't standard in the screening." "We had help," Dr. Morrison said, gesturing to Michael. "Doctor?" Brennan shook her head. "Military medic, right? You know we have a position opening in our trauma department, someone who can think like this, clinical and practical. We could use that." "He's not credentialed," Rachel pointed out. "Then credential him. I'll sponsor the application myself." Dr. Brennan looked at Michael. You interested? Michael felt everyone's eyes on him. The same question General Holt had implied, Dr. Morrison had suggested, that he'd been running from for 3 years. I need to think about it. Fair enough. Offer stands. After she left, Michael went to check on David, found him awake, watching the news coverage of a training accident at Fort Bragg. 7 wounded, David said quietly. 3 critical. Michael saw the look in his eyes, the same look he'd had after every casualty report in Kandahar. You can't save them all, Michael said. I'm not even there. I'm stuck in a hospital bed because my appendix decided to throw a fit. You're here because your body needed help. That's not failure. Feels like it. My unit is deployed next month. Middle East again, I should be with them. You will be, once you heal. You left, David said. Yeah, Dad told me after Kabul. You left the military because you couldn't handle the losses. That's not exactly, isn't it? David's eyes were sharp despite the medication. 4 soldiers died. You saved 19, but you walked away because 4 wasn't good enough. The words hit harder than they should have. I walked away because I couldn't guarantee I wouldn't fail again. None of us can guarantee that. My dad can't guarantee every soldier makes it home. The doctors here can't guarantee every patient survives. You can't guarantee anything in medicine or combat. You just do the best you can. And when your best isn't enough, then you live with it. And you do better next time. David's voice was firm. You think my dad doesn't carry every soldier he's lost? He does. I've seen him at memorials, read letters to families, but he keeps serving because that's what we do. We don't quit because it's hard. Michael didn't have an answer for that. At 6 p.m., everything went wrong. David's monitors started alarming, not the steady decline they'd seen before, but sharp, sudden deterioration. Michael was in the break room when he heard the code called, dropped his coffee and ran. Room 408 was chaos. David was seizing, blood pressure through the roof, heart rate erratic. Doctor. Morrison was shouting orders. Get me lorazepam! I need a CT now. Rachel was already pushing the medication. What happened? He was stable 20 minutes ago. Michael pushed through to the bedside, looked at David's pupils. Unequal. One dilated. Bleed, he said sharply. Brain bleed. From what? There was no head trauma. It doesn't matter. Look at his pupils. Get him to CT right now. Dr. Morrison met his eyes, saw the certainty there. Move. Get him to imaging. They were running down the hallway, Michael keeping pace beside the gurney. David was unconscious now, the seizure controlled, but the underlying problem growing worse by the second. How did you know? Rachel asked as they moved. Seen it before. Combat casualty. No apparent head injury, but developed delayed hemorrhage from stress and blood pressure spikes. Or the compartment syndrome, the surgery, the infection response. His system's been under massive strain. The CT confirmed it. Small bleed in the right frontal lobe, growing. The neurosurgeon on call was Dr. James Park. He looked at the scans and swore. This is going to require evacuation. Immediate. How long? Dr. Morrison demanded. I can be prepped in 30 minutes. He might not have 30 minutes. Dr. Park's expression was grim. Then we'd better move fast. Michael stayed with David while they prepped. The OR held his hand, the same way he'd held the hands of soldiers waiting for medevac choppers that sometimes came too late. You're going to be okay, he said quietly. Knowing David couldn't hear him, saying it anyway. You're going to make it through this. You're going to get back to your unit. You're going to make your father proud. He thought about the soldiers in Kabul, the 4 who didn't make it. He thought about the 19 who did. He thought about standing here, right now, choosing not to walk away. I'm not losing you, Michael said. Not today. Dr. Morrison appeared beside him. They're ready. We need to move him now. Go with him, Michael said. What? To the OR. You go with him. I'll wait here. Chen, I can't be in an OR again. Not yet. But you can. You'll make sure he's okay. Dr. Morrison searched his face, then nodded. I'll make sure. They took David away. Michael stood in the empty room, surrounded by silent monitors, and felt the weight of every choice that had led him here. The OR waiting room was empty at 8 p.m. on a Wednesday. Michael sat in an uncomfortable plastic chair, still wearing his custodial uniform, staring at his hands. All these hands had saved lives, had failed to save lives, had tied tourniquets and pushed medications and held pressure on wounds that wouldn't stop bleeding. These hands had mopped floors for 6 months, trying to forget what they used to do. Rachel found him there an hour later, sat down beside him without speaking. You don't have to wait here, Michael said finally. Neither do you. But here we are. They sat in silence. I read your research papers, Rachel said eventually. The ones on field trauma protocols, they were brilliant. They were practical, different thing. No, they were both. That's what made them good. She turned to look at him. I owe you an apology. For what? For dismissing you, for seeing the uniform instead of the person.
Yeah, and for being so caught up in hierarchy and credentials that I forgot what actually matters. You were doing your job. I was being arrogant. There's a difference. Rachel's voice was quiet. I've been a nurse for 15 years. I'm good at it. But I've gotten comfortable. Stopped questioning. Stopped learning. You saved David's life tonight? After you told me how, if you hadn't been here, she trailed off. I've been thinking about how many patients we might have lost because we were too proud to listen, too certain we were right. Michael didn't answer. My mother was a nurse, Rachel continued, Korean immigrant, brilliant woman, but American doctors never listened to her, always dismissed her because of her accent, her credentials from overseas. She knew she was right half the time.
But nobody would hear her. I'm sorry. She told me once that medicine wasn't about authority. It was about seeing what was in front of you and having the courage to act on it. Rachel looked at her hands. I forgot that. Got caught up in proving myself, establishing my expertise. Became exactly what made her invisible. The OR doors opened. Dr. Morrison walked out, still in her surgical scrubs. Blood on her sleeves. Michael and Rachel stood up. Dr. Morrison's face was unreadable. Then she smiled. He's okay. Bleed is evacuated, no permanent damage. Dr. Park said it was textbook. We caught it just in time. Michael felt something release in his chest, something that had been locked tight for 3 years. Thank you, he said quietly. Don't thank me. Thank you for seeing what we missed again. Is he awake? In recovery.
He'll be out for a few hours, but he's going to be fine. Dr. Morrison sat down heavily, looked at Michael. I called the hospital administrator, explained the situation. General Holt's call helped, but honestly, what helped more was David's outcome. 2 life-threatening complications caught and corrected because of your assessment. Where are we going with this? Michael asked. I'm offering you a position, not as a janitor, as a clinical consultant working under my supervision until we can get you properly credentialed. It's not ideal, but it's a start. Michael looked at his hands again. Thought about David. Thought about the soldiers in Kabul. Thought about spending the rest of his life mopping floors, pretending he wasn't who he was. I need conditions, he said slowly. Name them. If I fail, if I make the wrong call and someone dies because of it, I walk away. No arguments, no discussions. I'm done. Dr. Morrison met his eyes. And if you make the right call and someone lives? Then maybe I stay a little longer. Deal. General Marcus Holt arrived at Metropolitan ICU at 0800 the next morning. Michael was reviewing David's overnight vitals when he felt the change in atmosphere. The way everyone suddenly stood straighter, the way conversation stopped mid-sentence. He looked up to see the general walking through the double doors. 4 stars on his shoulders, 3 rows of ribbons on his chest. The kind of presence that commanded rooms without saying a word. Their eyes met across the unit. For a moment, Michael was back in Kandahar, standing at attention while the general toured the field hospital.
All being told he'd done good work, being offered opportunities he'd later walk away from. The general crossed the floor, stopped in front of Michael. "Sergeant Chen." "I'm not a sergeant anymore, sir." "Once a soldier, always a soldier. You know that." The general's eyes scanned Michael's face. "You look like hell." "Rough couple of days, sir." "I heard. Saved my son's life. Twice." The doctors... "Save it." "I've read the reports. Multiple attending physicians credit you with catching complications they missed. Dr. Morrison says you're the best clinical diagnostician she's ever worked with." Michael glanced over to see Dr. Morrison watching them. She gave a small nod. "I was just doing what I could, sir. That's all any of us ever do." The general's voice softened. "Can I see him?" "Of course. Room 408. Michael started to step back, but the general caught his arm. "After I see David, you and I are going to talk. Clear?" "Yes, sir." Michael watched the general walk to his son's room. Saw the moment David opened his eyes and saw his father. Saw the relief and love pass between them in the way that only comes from shared understanding of service and sacrifice. Dr. Morrison appeared at Michael's elbow. "He's terrifying. He's one of the best leaders I've ever served under. He thinks very highly of you. He thinks highly of anyone who does their job well." "No." Dr. Morrison's voice was firm. "He thinks highly of you specifically. I spoke with him on the phone for 20 minutes last night. He told me about Kabul, about what you did that night, about 19 soldiers who are alive because you refused to give up." Michael felt his chest tighten.
He tell you about the 4 who died?" "He told me about the 4 soldiers who died despite everything you did to save them. There's a difference, Chen, a big one." Rachel joined them. "David's latest labs look good. No signs of infection, neurological function normal. The surgeon says he can probably transfer out of ICU tomorrow." "Good." Dr. Morrison checked her watch. "I have a meeting with administration in an hour about your position here." "I haven't decided yet," Michael said. "I know, but when you do, I want everything ready." She walked away. Rachel studied Michael. "You're really thinking about walking away again? After all this?" "I'm thinking about whether I can handle being back in medicine, whether I can carry the weight of it." "You're already carrying it. You have been for 6 months." "Ah, you just haven't admitted it yet." Before Michael could respond, General Holt emerged from David's room, gestured for Michael to follow him. They walked to the family consultation room. The general closed the door. "Sit." Michael sat. The general remained standing, looking out the window at the city below. 3 years ago, you left my command, requested discharge. I tried to talk you out of it." "Yes, sir." "I told you that you were one of the best medics I'd ever seen, that the army needed people like you, that walking away was a mistake." "You did, sir. I was wrong." Michael looked up, surprised. The general turned to face him. "I was wrong because I didn't understand what that night cost you. I saw the tactical picture, 19 saved versus 4 lost. But I didn't see what it cost you emotionally."
"On what carrying those 4 deaths would do to you?" "Sir, let me finish." The general's voice was firm but not unkind. I've commanded thousands of soldiers, sent them into combat, watched some come home and others don't. I carry every single one of those losses, but I've had 30 years to learn how to carry that weight. You had 18 months, and then one night that tried to break you. The general sat down across from Michael. I should have seen it, should have gotten you help instead of decorations, should have recognized that trauma doesn't care about tactical success. You did see it, sir. You recommended I get counseling. I recommended it. I didn't order it. I didn't make sure you actually got the help you needed. The general's expression was heavy. That's on me. Sir, you had an entire division to command.
I was just one medic. You were my soldier. That means you were my responsibility. The general leaned forward. I'm asking you now, are you okay? The question, asked with genuine concern by someone who'd once commanded him, hit harder than Michael expected. I don't know, sir. I thought I'd moved past it. But being back here in a hospital, responsible for lives again, he trailed off. Scared the hell out of you? Yes, sir. Good. Michael blinked. Sir? If you weren't scared, I'd be worried. Fear means you understand the stakes, means you respect the responsibility. The medics who scare me are the ones who aren't afraid of failing. But I did fail, sir. 4 soldiers died in combat, not because you failed them, and because war is hell, and sometimes people die despite everything we do. The general's voice was steel. You need to hear this, Chen. Really hear it. Those 4 soldiers died because a mortar hit a medical tent during an attack. Not because you made the wrong call, not because you weren't good enough, because war is chaos, and chaos doesn't care about skill or dedication. Michael felt something crack in his chest, 3 years of guilt pressing against the truth he'd been refusing to accept. But I chose, he whispered. I triaged them, decided who to save first, and 4 of them died while I was working on the others. You made the right triage decisions. The inquiry confirmed it. Every senior medical officer who reviewed the case confirmed it.
I mean, you saved the maximum number of lives possible given the circumstances. That doesn't make it hurt less. No, it doesn't. The general's voice softened. And it shouldn't. The day those deaths stop hurting is the day you've stopped being the kind of medic who can save lives. The weight of it, the memory of the ones you couldn't save, that's what makes you fight so hard for the ones you can. Michael looked up, met the general's eyes. David is alive because you still carry that weight, the general said. Because you saw a 23-year-old soldier and couldn't walk away. Couldn't let him become number 5. The truth of it settled over Michael. I'm proud of you, the general said. Not just for saving my son, for surviving Kabul, for carrying that weight for 3 years. I'm for finally being ready to pick up the tools you put down. I'm not sure I'm ready, sir. Nobody's ever ready. We just do the work anyway. The general stood. Dr. Morrison tells me she's offering you a position. Yes, sir. You going to take it? Michael looked at his hands. The same hands that had failed 4 soldiers, that had saved 19 others, that had just saved David Holt twice. I don't know, sir. Then let me make it easier. That's an order, Sergeant. Get back in the fight. Michael almost smiled. You can't order me, sir. I'm a civilian. Then I'm asking, as a father whose son is alive because of you, as a commander who never should have let you leave, as someone who believes you're exactly where you're meant to be. The general extended his hand. Michael looked at it, then took it. I'll think about it.
What, sir? That's all I'm asking. Michael spent the next hour walking the hospital, not the ICU, just walking. Through the cafeteria where workers were setting up for lunch, through the main lobby where families waited for news, through the chapel where someone was praying quietly. He found himself in front of a memorial wall, names of hospital staff who'd served in the military, decades worth. Different wars, different branches, different eras. All of them had come home and chosen to keep serving. Thought I might find you here? Michael turned to see Amy, the young nurse who'd spoken up for him. Just thinking, he said, about whether to stay? Something like that. Amy moved to stand beside him, looking at the memorial wall. My grandfather's name is up there. Army medic, Vietnam.
And he came home and worked in the ER for 35 years. That's a long time. I asked him once why he kept doing it. After everything he'd seen in the war, why come back to medicine? Amy smiled. He said it was because he knew what it cost to lose people, knew what it felt like to watch someone die and wonder if you could have done more, and he decided that the only way to honor the ones he couldn't save was to save everyone he could after. Michael felt the words settle into the cracks the general had opened. He told me something else, Amy continued. He said the medics who quit weren't the ones who'd lost people. Everyone loses people in medicine and war. The ones who quit were the ones who couldn't forgive themselves for being human. I'm not sure I can forgive myself. Maybe you don't have to. Or maybe you just have to accept that you did everything you could, and that's enough. They stood in silence. Dr. Morrison is tough, Amy said, but she's fair, and she sees potential in people. If she's offering you a position, it's because she believes you belong here. What if I fail again? Then you'll fail, and you'll get up and try again, same as the rest of us. Amy turned to look at him. You saved that patient's life, twice, while wearing a janitor's uniform. Imagine what you could do with actual support and resources. She walked away, leaving Michael alone with the names on the wall. All those people who'd chosen to keep going. He thought about David Holt, recovering upstairs. About 19 soldiers living their lives because Michael hadn't given up in Kabul. About the 4 who didn't make it, but who would want him to keep fighting for others. He thought about the general's words. Once a soldier, always a soldier. But more than that, once a healer, always a healer. You could take off the uniform, change the title, hide behind a mop and a cart. But you couldn't change what you were built to do. Michael pulled out his phone, called Dr. Morrison. Chen? I'll take the position, on one condition. Name it. I want to work with medical students, teach them what they don't learn in textbooks, how to see the details everyone else misses, how to question authority when the patient needs it, how to carry the weight of the ones they can't save. Silence on the line. Done, Dr. Morrison said. Anything else? Yeah, I need to buy some new clothes. This custodial uniform is getting old. He could hear the smile in her voice.
I think we can arrange that. Welcome back, Chen. Thank you, Doctor. Dr. Morrison is fine. We're colleagues now. Then call me Michael. Deal. Now get up here. David's asking for you. Michael headed for the elevator, caught his reflection in the polished metal doors. Still the same person, still carrying the same weight. But maybe that was okay. Maybe the weight wasn't a burden to escape. Maybe it was a reminder of why the work mattered. The elevator doors opened. Michael stepped in. Going up. 6 months later, Michael stood in front of a classroom of first-year medical students, not as a janitor, as a clinical instructor. Dr. Morrison had made good on her promise, helped him navigate the credentialing process, sponsored his application for a clinical teaching position.
I leveraged General Holt's connections when bureaucracy threatened to slow things down. It hadn't been easy. There had been setbacks. Nights when the nightmares from Kabul came back stronger. Moments when he'd stood outside a patient's room, paralyzed by the fear of failing again. But Dr. Morrison had been there, Rachel had been there, even Amy, who'd somehow become his strongest advocate. And David Holt had recovered, made a full return to his unit, deployed to the Middle East 3 months ago and sent Michael a message just last week. Still have both legs, thanks for that. Now, Michael looked at the 20 students in front of him and saw their certainty, their confidence in protocols and textbooks and the hierarchy they'd been taught to trust. Medicine isn't about memorizing protocols, he began.
It's about seeing what's in front of you, about questioning authority when the patient needs it, about having the courage to speak up even when you're the lowest person in the room. He told them about David Holt, about being dismissed as a janitor, about saving a life from outside the system. You're going to fail sometimes, he said. You're going to lose patience, make wrong calls, watch people die despite everything you do. That's not a maybe, that's a certainty. The students looked uncomfortable. This wasn't the inspirational speech they'd expected. But here's what matters, Michael continued. How you carry that weight. Whether you let it break you or whether you let it make you better. Whether you quit or whether you get up and try again. He thought about the 4 soldiers in Kabul. Still thought about them every day.
Well, probably always would. But he also thought about the 19 who survived, about David Holt, about the 3 patients he'd helped save in the past month through careful observation and willingness to challenge assumptions. I'm not going to lie to you, he said. This job will cost you. It will take pieces of your soul. It will give you nightmares and doubts and moments where you question everything. He paused, met their eyes. But it will also give you the chance to save lives, to make a difference when it matters most, to be the person someone needs in their darkest moment. The classroom was silent. So here's my question for you, Michael said. When that moment comes, and it will come, are you going to be ready? Are you going to see what others miss? Are you going to have the courage to act? A hand went up. Young woman. Front row.
How do you know if you're ready? Michael smiled. You don't? Nobody's ever really ready. You just do the work anyway. He thought about General Holt's words, about Dr. Morrison's faith, about his own journey from Kandahar to a custodial closet to standing here, teaching the next generation. You just do the work, he repeated, and you trust that it's enough. The lecture ended. Students filed out, some staying to ask questions, others heading to their next class. Michael gathered his notes, caught sight of his reflection in the classroom window. No longer hiding, no longer running, just doing the work. And finally believing it was enough.